The nation's countryside may be peaceful and pretty, but there are some drawbacks to living out here, including the fact that healthcare can be hard to find or get to. But a new generation of nurses may hold the key to changing that. In what looks like a hospital, these nursing students are about to be transported to another world.
We are currently sitting in what's called our Clinical Learning Resource Center. And this is where we do simulations with all of our programs.
Simulations that are courtesy of virtual reality. At Texas A&M University's School of Nursing, students are using it to gain real-world experience in treating patients.
So it's really introducing them to an area of care for nurses that's outside of the acute care setting.
Dr. Elizabeth Wells BEEDE says the simulations are designed to take place away from a large hospital setting and instead in a place these students might find in a rural area.
Oftentimes we're kind of experience things in a hospital setting, so it was really nice to see a kind of doctor's office setting in virtual reality.
I really liked how we could apply our knowledge in a completely different environment.
It feels like you're in the simulation.
In this simulation, nursing students are helping a young boy manage his diabetes.
I think having a person in front of me, regardless of whether it's a simulated patient through the VR or even a real person in front of me, I think is really the best way for me to apply my skills and apply my knowledge.
So go ahead and hit your Oculus button.
The VR simulations they focus on here revolve around common medical conditions people in rural areas often face, like managing chronic conditions, mental health, and maternal postpartum care, as well as substance abuse.
That's the end of our questionnaire.
Something students here faced one-on-one with a virtual patient.
We had to ask some questions and delve deeper throughout the conversation, and the AI or the patient actually talked back to us.
The pandemic prompted telehealth to expand rapidly, making virtual visits more commonplace and highlighting the need for training like this to better help get care to patients.
Before COVID, you saw maybe 1 or 2 vendors that were doing different things with VR, to now you see anywhere up between 10 to 15 vendors. So a lot of healthcare institutions are really looking at VR and how it can be implemented into not only academia but also practice.
And placing these future nurses on the cutting edge of a new frontier in healthcare. Maya Rodriguez, SCRIPPS News, Round Rock, Texas.